All right now, thousands of students are back in classrooms across our area. That number going way up over the next week.
That's right. That's why parents need to get our children's immune systems ready for all of the sickness that comes with the return to the classroom. It's true. Our Ugochi Iloka spoke to medical experts, sharing some useful reminders to help us to plan ahead.
When students head back to school, they usually prepare by getting supplies and new threads. But there's something else parents need to get squared away for their children, too.
Okay, parents, before your kids get on the school bus for back to school, Texas Children's Dr. Tiffany Nguyen says it is so important that you check in with your child's pediatrician to set up either a wellness visit or a sports physical if you need it.
For us at Texas Children's 12 and up, we do also, when they come through for checkups, we do a mental health check. And so we ask questions around that so that we can kind of gauge, because sometimes kids are as forthcoming or they may not quite understand or process the feelings they have. But if we ask non-specific questions, it might help them to see, help us to see, and help parents to see that there might be an issue that we need to address. And that goes around anxiety or depression.
Along with that mental health check, both pediatric doctor Tiffany Nguyen and emergency room doctor Eric Higginbotham with Texas Children's suggest you stay on top of your children's shots.
From birth, all the way through until they graduate from us and going into the adult world, we want to make sure kids are safe. So we do have guidelines and timetables of when each immunizations are due, and we have a schedule for that, and we follow the American Academy of Pediatrics guidelines, and that has not shifted at all. Now, I understand that there's some confusion and some fear around these things, and so it's very important to have a good relationship with your pediatrician to kind of discuss through these things.
When you look back at the numbers from 2024 into 25, there were actually about 300 pediatric deaths across the United States from influenza. So if not addressed, it can be serious. The younger the child is, the more susceptible they are to getting dehydrated or having serious complications from influenza. So it's the younger kids, and those are the ones you want to try to protect with vaccination when you can.
As for what common illnesses families can expect to see, well, there's quite a few.
Important to think kids have been away and now they're all put together. So any germs that festers is going to be shared, okay? There's no discrimination there. So with kids, you think about stomach bugs, stomach viruses that can cause sometimes fever, vomiting, diarrhea, dehydration, strep goes around.
These kids get back into the classroom and are mixing around, and these viruses start circulating. Our volumes can sometimes double compared to what they are during the summertime. Once school gets back in, it tends to be much more infectious and fever related that we see in the emergency department.
And if you aren't careful enough, those nasty viruses can spread quickly.
I see often what happens is one child will get sick, and then maybe end of the weekend, the parents will get sick, and then the siblings after that. So it kind of cycles through the home, and that's really difficult.
On top of that, some children can be worse off than others if they fall ill.
So even if it's not a illness that has vomiting and diarrhea and it's just fever, kids kind of shut down when they don't feel good. And by shutting down, I mean they're just going to lay there. They're not going to take a lot of liquid by mouth, and then they can get dehydrated. Prolonged dehydration can cause kids to become very sick. And a lot of times those children will then need to have an IV placed, have some IV fluid.
There are some easy to remember health tips you can practice with your kids now so they can use when they return to school.
So with kids, I say, do not touch your face. So germs come through to you via your eyes, your nose, your mouth, and any open wound areas. So it's important to wash hands. And the rule around that is 20 seconds. As long as it takes to sing happy birthday, right? And so if you have to cough or sneeze, use a tissue or cough or sneeze into your arm.
Finally, I asked this last question so parents can get ahead of any pesky illnesses that arise this new school year.
Is there anything else that families can do to avoid a trip to the ER for back to school?
Sure, anytime you see your kid beginning to get sick, try to control the fever. And then by controlling the fever, you can alternate acetaminophen with ibuprofen to keep that down.
A simple reminder that could save your child from a lot of discomfort. Ugochi Iloka, KHOU 11 News.
Okay, good advice. Now, Texas Children's also beefs up their ER staff at their emergency rooms, gearing up for this start of school as they prepare for a potential surge in these serious patient illnesses. So just a little bit of prevention can go a long way this time of year.
All right, let's enjoy that last week of summer. For most